Thank you all for joining me today. Today, we once again saw our number of new cases of COVID-19 inch up yet again. And Dr. Levine will go over these figures in more detail in just a few minutes. But while we're no longer seeing exponential growth of new cases daily, this continued growth should serve as a reminder to everyone that we do not yet have this virus under control. Now's not the time to get complacent. We need to buckle down and recommit ourselves to eliminating as much contact as we can with people outside our homes. If we all continue to work together, we can push down that growth rate. Over the past few days, we've had new case rates of 1,400, 1,500, 1,600, and now we have more than 1,800 people hospitalized with COVID-19. We're launching a new hospital preparedness dashboard that will let anyone see a county-by-county breakdown of key equipment availability and usage. And Dr. Levine will be giving more information on this in just a few minutes. You'll be able to see from the dashboard that cases are not evenly distributed across the state, per capita or per hospital. Some communities have been hit harder, while others have seen slower growth. Combating a pandemic means we all have to work together. And that means we need to make the best use of our medical assets to ensure the places that need them the most have them. So today I'm signing an order that will allow us to transfer needed supplies between medical facilities. This will allow us to move key equipment like personal protective equipment and ventilators to high population, high impact areas. And it will also allow us to bring resources into lower population areas that might not have as many existing medical resources. This will also prevent sick Pennsylvanians from having to choose which hospital to go to for fear that some have less access to equipment than others. And it will help us make use of every ventilator, every piece of personal protective equipment, and every bed. Now, I want to commend Pennsylvania's medical facilities for their efforts so far in helping to shift resources toward the fight against COVID-19. Many are already working together to shift resources among facilities, both public and private. And many of our medical facilities have shifted resources internally. This order will help us further mobilize our healthcare system to care for every single Pennsylvanian who becomes sick with the 2019 novel coronavirus. But I want to reiterate that the best way to assist our healthcare system during this pandemic is to do everything we can to stop the spread. We need to continue remaining in our homes unless it is absolutely necessary to leave. We need to wear masks if we must leave our homes. We need to wash our hands frequently and thoroughly. And we need to protect others if we are sick by self-isolating and covering our coughs and sneezes. Pennsylvanians have risen to the challenge so far, and I truly believe we have the fortitude and the self-discipline to continue with these efforts until we get through this pandemic. So thank you. And now I'm going to turn this over to Dr. Levine.
Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,680 new cases of COVID-19. This brings our statewide total to 16,239 Pennsylvanians who have tested positive for COVID-19 now in all 67 counties. Approximately 760 of our healthcare workers are positive for COVID-19 out of the total number of cases. And 831 of our total cases are positive in 157 long-term care or personal care facilities. Tragically, we have had 309 deaths among those who have tested positive for COVID-19. To date, all of those deaths in Pennsylvanians are in adults. As of noon today, hospitals are reporting that approximately 1,892 patients are currently hospitalized due to COVID-19. This is approximately 11% of the total case count. 1,169 of those hospitalized have required ventilators. Across our healthcare system, approximately 51% of hospital beds, 40% of our ICU beds, and nearly 70% of our ventilators are available at this time. As you know, each day I talk about hospital capacity. Now we have hospitals reporting this information directly to us, and we want to give Pennsylvanians a better idea of what is happening throughout Pennsylvania and in their county. Our teams have created a new hospital preparedness dashboard, as the governor had said, that provides county-level information about how many beds and ventilators are in use and available to meet our health care needs. The dashboard also provides an overview of our entire health system capacity. We are continuing to work to create more ways to get as much data as possible to the community. In the symptoms and testing section of our website, we also now have added a statewide map about where testing is occurring. Now, these sites may require pre-registration or a doctor's script in order for a test to be taken. So please check with your health care provider before going to one of these locations. All of this information can be found in the COVID-19 section of our website at health.pa.gov. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or as we all know now, the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go outside for life-sustaining activities, please wear a mask, especially if you're going to come in contact with others. Practicing these everyday prevention measures can help slow the spread of this dangerous virus, COVID-19. If you have questions about your health, contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now the Governor and I will answer questions.
Thank you, Secretary. Our first question is for Governor Wolf. From Capitol Wire, does your new PPE order amount to a confiscation of equipment from various sources, including what would appear to be lower priority health care providers, to redistribute them to hospitals? If so, what do you have to say to health care providers who will now go without PPE because of this order?
I'm trying to, as I said in my comments, I'm trying to make sure that we take this scarce set of resources that we have and make sure that we're deploying them in the areas that need them the most. And that is a back and forth, and it could be helpful to hospitals that now seem to have more than they need and maybe in the future will not. So we need to be open to, I think, this kind of coordination within the Commonwealth so that we're taking this scarce resource, this set of resources that we have, and making sure that they're being used and deployed in the places that need them most.
Governor, from Bloomberg and NBC 10, what were the key takeaways from your call with President Trump?
That was the last call actually was with the Vice President. The call with President Trump was last week. And it was that the federal government continues to work on things like, at the federal level, the coordination of supplies. In the Vice President's call just yesterday, we talked about a control tower kind of operation where the federal government is trying to make sure that scarce resources, equipment, ventilators get to the places that need them the most.
Governor, from Penn Live, should high school athletes continue to hope that they will get to finish their winter sports championships or play spring sports this school year? President Trump has also said that he thinks that NFL and college football should start on time in September. Is that realistic?
Well, those are two different things. I think it's too early to call what happens in the fall. As for what happens in the winter sports season, unfortunately, every sport professional and non-professional sport, amateur sports have closed down, and I think Pennsylvania needs to follow suit on that. We need to stay safe. Again, our first priority is to stay safe.
And Governor, from ABC 27, there was a fight in the State House yesterday over your power during the COVID-19 outbreak. House Republicans think your shutdown of businesses is too severe, and some of them, if they could do safely, should be allowed to continue operating. What is your response to their criticism?
Well, we're a democracy, and we have a robust conversation, but I think on the part of all of us, the legislature and the executive branch, we're trying to buy time. We're trying to get ahead of the spike in the demand on demands on our health care system, and we're trying to keep people safe. And that forces us to make some tough decisions. But again, I think all of us are agreed that we want to keep people safe. We want to buy time so that we don't overstress our health care system.
Secretary, the next question is for you. From CNBC, can you share about Pennsylvania's efforts to secure PPE for essential workers and discuss any challenges you're facing to get enough supplies?
Mm-hmm. So we have been working tirelessly over the last number of months to obtain personal protective equipment. So that can include the N95 masks for patients for healthcare professionals taking care of patients directly with COVID-19, as well as other type of surgical masks, gowns, gloves, all of that personal protective equipment. We have received shipments from the national stockpile, and we have pushed that out to the healthcare facilities, which includes hospitals, health systems, and long-term care living facilities. In fact, we have distributed over 1.8 million N95 masks and almost 900,000 of the surgical masks over the last number of months. So we have been also working to get those supplies from manufacturers throughout Pennsylvania, throughout the nation, and actually throughout the world. And we also are working on a system where we might be able to sterilize N95 masks using a number of different methods. So we will do everything we possibly can to supply these needed resources to healthcare professionals in the field.
Secretary, we have multiple media outlets asking about any progress that's been made in identifying the race and gender of COVID-19 patients in Pennsylvania.
So unfortunately, we really don't get that information on a regular basis through our regular data system, but we are working on some novel ways to be able to get that data and then to give that data to the media and the public.
And then as a follow-up, the U.S. Surgeon General spoke about African Americans having more pre-existing medical issues, less access to health care, and are more likely to work in unstable jobs. Do you see that happening in Pennsylvania?
Well, we have been concerned about health equity and what we call the social determinants of health now for years. The social determinants of health include economic opportunity. They include nutrition. They include the environment. They include transportation. transportation and access to health care. And so we know that there are challenges in health equity for African Americans as well as Hispanic Americans in Pennsylvania and throughout the nation. So we have been working at the Department of Health in collaboration with the Department of Human Services and Governor Wolf's administration to address those before COVID-19 occurred. Of course, those same disparities are even more significant now that we have a global pandemic. So we'll be working again to try to make sure that those health disparities do not influence someone's ability to get the care they need to treat COVID-19.
Governor, our next question is for you. From WNEP, you previously said that you had no plans to send the National Guard to the Hazleton area. But now with coronavirus cases, they're numbering more than 1,000. What, if any, is the state going to do to help this area of Luzerne County get things under control?
Well, I'm working with local officials up there. I had a call yesterday with Congressman Matt Cartwright to talk about some things we might do. None of those involved sending in the National Guard. But again, as I said in my last press conference, we're talking about all the different ways that the state can help places like Luzerne County and Hazleton. And I will continue to have those conversations, but as of now, we don't have the National Guard. Let me just get back to the last question that Secretary Levine talked about. I had a call with the Vice President today and was pleased to hear that the federal government is now going to be taking a closer look at the ethnic distinctions and the different ways that COVID-19 is affecting our population. And I was heartened to hear that they are really going to take a look at how this affects people differentially, who suffer from hypertension, who suffer from diabetes, who suffer from all the other kinds of things, the comorbidities they're called, that go along with this disease, and that affect certain populations more than others. So I was heartened to hear the Vice President say that the federal government now is committed to taking a look at that and taking that much more seriously. So I think that's a good sign for all of us, for all the states that are looking to the federal government for statistical help.
Governor, from Penn Live, what has business and manufacturers' response been to the Department of Community Economic Development's critical medical supplies portal?
Don't hold me on this, but I think we've had over 400 applications as of 2 days ago. I'm not sure where we are as of today. This is yesterday, sorry. As of today, I'm not sure. And I think we thought that maybe 70 or 80 of those actually have something that can be very helpful in terms of addressing this. So the business community has stepped up. I expect, although, as I say, I don't know what the statistics are for today, that there are even more who have tried to access that portal with offers of help. I get those personally. I get those through my official email address, and we're getting that through the Department of Community and Economic Development. So I think the business community really is trying to help here.
Secretary, the next question is for you. From the Associated Press, the rate of new infections has declined each day for the last 7 days. What does that tell you about the trajectory of this pandemic in Pennsylvania? And is the rate of increase a better metric than raw numbers, which continue to see day-over-day increases?
Mm-hmm. So we certainly do expect to see the raw numbers increase over the time of this pandemic. But you're correct. We have seen a subtle flattening of the curve, which is good news. We are still seeing, though, significant increases. Today it was over 1,600 new cases, but the curve is flatter. As the governor said, it's no longer going up at an exponential curve, which was doubling every number of days. So that's really good news. I think that is evidence that the governor's efforts in terms of mitigation, in terms of prevention, such as the school closures, the closure of non-essential life-sustaining businesses, and the stay-at-home orders, which went out in an iterative fashion, and then the entire state under a stay-at-home order, has been successful in terms of flattening the curve. But we cannot become complacent. It is essential that we continue to practice this social, physical isolation to continue that flattening of the curve. We do expect a surge, so to speak, in terms of the number of new cases, the number of cases that go to our healthcare system, unfortunately and tragically the number of deaths. But if we are able to keep that as a flatter curve, as been shown by Dr. Fauci many times in the national briefings, then we will not overwhelm our healthcare system in terms of supplies, beds, ventilators, and staffing. So it's essential now, more than ever, to please stay home.
Secretary, from the Philadelphia Inquirer, Deborah Birx said this morning at the White House Coronavirus Task Force that they're concerned about the Philadelphia region becoming one of the next hotspots due to trends in daily case reporting and testing. Has there been any direct federal support due to this anticipated surge, and do you expect any?
So we did hear that before from Dr. Birx, and so that sort of is more evidence of what we've been saying, is that even though the curve is somewhat flattened, Philadelphia and the Southeast remain an area of significant concern. Philadelphia has more than 4,400 cases, more deaths. Another area of concern for us is the Northeast. The governor has mentioned the Hazleton area in Luzerne County, but also Lehigh Valley and Monroe County was discussed. So those are the areas that are of most concern. The western part of Pennsylvania has seemed to remain more stable, but we'll be watching that as well. And the governor had referenced a phone call from the vice president, and I believe he'll talk about what the vice president discussed about resources to deal with this potential surge of cases and the quote-unquote hotspot in Philadelphia.
Secretary, as a follow-up to that, Philadelphia health officials just said they believe their numbers are stabilizing. How does that reconcile with the predictions that there is a surge coming?
Well, I think both are true. By stabilizing, it means that exactly what I said before, is that the curve has flattened somewhat, that it's not going up in this exponential way, but they have been increasing. But we want to remain optimistic and positive that we will be able to cope with this increase in patients with our healthcare system. But the key to that, as we have been emphasizing, is the social and physical distancing and the stay-at-home orders from the governor. So please, please stay home.
Governor, the next question is for you. From WJAC, we're getting a lot of questions as why fishing season was given a green light and other sport activities such as golf have not. Why not open up courses to walking only and keep the bars and restaurants associated with many of these courses closed, like so many of surrounding states?
That's a fair question. Let me just answer. I think Dr. Levine said the call from the vice president today was actually to say that the federal government now is looking at southeastern Pennsylvania as a hot spot, and that means that the federal government is actually bumping Pennsylvania up in terms of priority for getting this scarce equipment, personal protective equipment, ventilators, and things like that. So while it's not good news that Philadelphia and the southeastern part of the state is seen as a hot spot, it is going to be helpful in terms of getting more attention from the federal resources, and that's a good thing. In terms of the fishing, the Fish and Boat Commission made the decision to open trout season, I think, early. And the idea was that's something that people can do individually. Unlike golf, where you actually have to go and pick up your cards and maybe actually congregate with other people. This is something you can do like hiking. You can be outside and do on your own. And one of the concerns I think I have, and I think we all need to have, is for the mental well-being of Pennsylvanians as we go through this. Staying at home is the best possible thing. Staying away from other people is what we need to do to keep this virus from spreading. And going out in the middle of a stream and trout fishing by yourself is something that I think could actually be good for your mental health and actually not contribute one bit to the spread of this virus.
Secretary, from Fox 43, in regards to your executive order today, will EMS and fire agencies be included in this order? The reporter is saying that I've had some EMS agencies reach out confused about what the order means for them.
Well, so this executive order means that the governor has the ability to move assets and resources to areas that are necessary. So it could involve primarily hospitals and health systems, but it could involve supplies for long-term care living facilities, and it could, in theory, apply to resources for EMS agencies as well. And so we want to be able to work with the hospitals, health systems, the nursing homes, EMS agencies, balance the needs according to where we're seeing the increases, and then be able to supply those needs in terms of all the resources that are necessary to take care of sick patients with COVID-19.
Secretary, we've had several questions about nursing homes. First, from WFMZ about hearing about from families and residents of nursing homes saying that the facility hasn't shared specifics on the number of positive coronavirus cases in their facility. What are the legal requirements for nursing homes to notify patients, and what would you recommend nursing facilities do to notify their residents, employees, and families?
Well, so, in terms of the notifications, there's always a balance between individuals' privacies and confidentiality of medical information versus the needs of public health, whether that's across the state, in a local area, or in a nursing home. Certainly, anyone that's positive will be notified. Depending upon the written consents, their family would be notified, and then close contacts would be notified because they would have to be in quarantine, and of course the patient themselves would be in isolation. We want facilities to, and of course they notify us and the county municipal health departments. And so there is always this balance in terms of the notifications, and we'll work to maintain that balance.
And then as a follow-up from the Post-Gazette, in light of outbreaks in nursing homes, are there any plans underway to designate certain facilities exclusively for COVID-19 patients?
So we have talked about that, and there was some recent CMS guidance about nursing homes and long-term care living facilities. And so one option would be that one facility, or even more likely maybe a wing on a facility, could be for patients with COVID-19, that you would cohort those patients and then separate the patients and the staff from the other patients who are not positive for COVID-19. So we're going to be looking at that and to see how we might operationalize that with, in consultation with the long-term care living facilities themselves.
And then from WESA, there are now 3 nursing homes in the Pittsburgh region with serious outbreaks where dozens of residents and staff have tested positive. What should these facilities be doing to contain the outbreaks and prevent further spread?
So we are working with all of the long-term care living facilities, whether they're nursing homes or personal care homes. We're working with the Department of Human Services in terms of the personal care homes and assisted living facilities that they regulate. And as we announced yesterday, we do have a contract with ECRI to provide consultative services remotely about infection control, as well as with our staff and our public health nurses and our epidemiologists. So we're going to work really, really closely with nursing homes. We'll discuss the new advice from the Center for Medicare and Medicaid Services about cohorting and do anything possible to protect vulnerable patients in Pennsylvania, in nursing homes, personal care homes, and the staff at those facilities.
Secretary, we have a couple of questions from WNEP and BRC 13 about East Stroudsburg University's field house being used for COVID patients or other medical issues. Is it a possibility that it will be used in the near future? And if so, will we see movement into it?
Well, so there are a number of different initiatives in the Northeast. So as we've been saying, in addition to the Southeast, Philadelphia and the Collar counties, the Northeast, whether it's Luzerne County, Lehigh County, Monroe County, others, have been an area of concern as well. And so we are looking to put in place a temporary medical facility in the Northeast, and we're also looking to put in a mass testing facility in the Northeast, and then we will provide whatever resources are necessary to the hospitals, health systems, and long-term care living facilities in that area to safeguard the population.
And Governor, our last question is for you from WJAC. As we know, unemployment and wage changes have had drastic effects on Pennsylvania residents. And as a result, some companies have raised their own minimum wages for workers. Do you think this will fall into place on a statewide level?
I was not aware of that happening in companies, but I think it's a good thing, and it would be a wonderful thing. As someone who supports an increase in the minimum wage, we need to make sure that people who work get a family-sustaining income, and I applaud companies that are raising the rates to make sure that their workers have that.
Thank you, Governor. That concludes our briefing for today. Our next briefing will be tomorrow.